where there is an age of marriage or consent to sex of 16. So there is often a 2-year gap where one can have sex but not determine the outcome of that gap. Additionally, conservative attitudes towards sex in our region give rise to discrimination, stigma, and silence around the topic of adolescent pregnancy, resulting in resistance towards comprehensive sexuality education, including through the health and family life education curriculum, which was, I believe, agreed in the region more than 24 years ago. Such hurdles contribute to the unmet need for family planning in the Caribbean, including in Guyana, where the unmet need is 61.9% among adolescents aged 15 to 19, and in Suriname, 59.7% for the same category. It is therefore critical that discriminatory laws and policy frameworks be addressed to protect particularly vulnerable communities, including young people, and better enable them to realize their sexual and reproductive health and rights, including bodily autonomy. Access to SRH services without parental consent and based on maturity and level of risk is also key. It is also important that we work towards changing the discriminatory attitudes of health workers, which also affect most at-risk groups and frequently result in poor health-seeking behaviors. Strengthening institutional capacity for the development and implementation of standards for quality healthcare services for adolescents must be prioritized. UNFPA's 2022 to 2026 sub-regional program for the English and Dutch-speaking Caribbean will seek to support government entities, particularly ministries of health and education, national statistics offices, and gender machineries, as well as civil society and faith-based organizations and other gatekeepers to address the existing legislative, policy, and supply barriers which hinder access to sexual and reproductive health services and information. The program will also actively strive to collaborate with women and young people, particularly adolescent girls and vulnerable populations, through meaningful and periodic consultations in all stages of policy and program development and in the implementation, monitoring, and evaluation of same. Addressing adolescent pregnancy requires cooperation and partnership, collaboration with key institutions, including those previously mentioned, is instrumental to developing and successfully rolling out innovative approaches and technologies to engage and reach young people and to empower women, young girls and boys with skills to fulfill their potential and the capacity to make decisions about their own bodies. Partnership is critical to evidence-based advocacy for legislative and policy reform and dialogue, as well as programming to advance comprehensive sexuality education in and out of school. I believe that together we can deliver on our vision of a better and more equal future for all Caribbean girls by creating a world where every pregnancy is wanted, every childbirth is safe, and every young person's potential is fulfilled. Thank you.
Thank you so much for your educational and impassioned contribution. At this juncture, I would like to welcome Dr. Andres De Francesco, Department Director, Family Promotion and Life Course, PAHO, Washington, D.C. Welcome.
Thank you very much, Therese, and good evening to everybody. It is my pleasure to greet the Honorable Minister of Health and Wellness from Belize, Honorable Michael Shebat, Alison Drayton, UNFPA Regional Director for the Caribbean, Ms. Helen Roger from the CARICOM Secretariat, other Caribbean colleagues, stakeholders, and friends, and last but not least, the young people who have been actively involved in the organization of all the events taking place this week. On behalf of the Pan-American Health Organization, I would like to congratulate you all for your collective efforts to to organize this series of events in the context of the Adolescent Pregnancy Prevention Week in the Caribbean. Last year, when PAHO and UNFPA jointly sent letters to all ministers of health of the region, inviting them to embrace these Adolescent Pregnancy Prevention Weeks as platforms for advocacy, joint actions, and increased commitments to address adolescent pregnancy, this was exactly our aim, to ensure that we don't take our eyes off the ball when it comes to this important public health problem. The COVID-19 pandemic has affected every single area of our lives, everywhere. Progress made in the improvement of the health and well-being of our citizens is being lost or at risk. And when I consider the estimated loss of 5 to 10 years of progress in the reduction of adolescent pregnancy in our region, that really saddens me, especially considering that adolescent fertility rates in our region were already unacceptably high then. This year, our focus is on pregnancy in girls younger than 15 years. We recognize that reliable data is limited, but the limited data is alarming and suggests that pregnancies in young girls are increasing in our region. We regularly see pregnancies in girls aged 10, 11, and 12 years old. This is totally unacceptable. These early pregnancies not only carry an increased risk for maternal mortality, but they negatively affect her education and development, with repercussions across the life course of the adolescent and her baby. Surveys and studies related to adolescent pregnancy tend to focus on the age group 15 to 19 years old. However, the global community has already emphasized the importance of pregnancies in girls younger than 15 years through the inclusion of this specific age group in the Sustainable Development Goals Indicator 3.7.2. We must start, therefore, with the routine documentation and monitoring of fertility in girls younger than 15 years old. But we must go beyond documenting them. Addressing pregnancies in young girls requires that we stop covering up taboo issues such as incest or sexual violence perpetrated by fathers, uncles, stepfathers, and neighbors. We have to do a better job to protect our girls through stronger legislation and policies, and establishment of mechanisms where girls subjected to sexual violence can report and find help. We also need to face the fact that as our adolescents go through puberty, they need access to information and education to understand and deal with their emerging sexuality and make informed choices. I congratulate countries that have made progress and challenge us all to do it better. This year's activities will culminate in a regional document that will hopefully help us to take strategic actions to continue addressing this important public health problem in the next few years. I have to say, I love the hashtag proposed by the young people. Hear me out. That's brilliant, very, very clear, and very appropriate. As PAHO, we firmly believe in facilitating and amplifying the voices of young people. Your contributions, young people, can greatly improve our efforts to reach and improve the health and well-being of young people. I am very pleased to see the active involvement of members of the PAHO Youth for Health group, including Teresa. Colleagues, on behalf of the Pan American Health Organization, I wish you all a very successful commemoration of the Caribbean Adolescent Pregnancy Prevention Week. Thank you very much.
Thank you so much, Dr. Andres de Francesco, for giving us so much to think about and for your vote of confidence in the adolescents and youth. So looking at the chat now, I see there's a lot of representation. I see persons from Jamaica, St. Vincent and the Grenadines, Dominica, Haiti, Belize, Trinidad and Tobago, Guyana. So I say good evening to you especially, and continue to communicate in the chat as well. So speaking of youth and adolescents, I would love to bring a youth and adolescent to the fore right now in the form of Ashley Anthony from Guyana. She is going to deliver a poem for us. Welcome, Ashley.
Good afternoon, everyone. Sorry about my light. I don't have good lighting in my apartment, but I am going to read a poem for you. Before I do that, I would like to acknowledge all of the dignitaries present, as well as everyone here present today making this event possible. And I would like to thank the organizers for allowing me the space to share this piece that was written specifically for this event. This poem is entitled Talk. There is whispering that a baby is coming. This type of talk, usually gleeful, today feels almost evil. Yes, there are whispers, but instead of baby showers and celebration, there is consternation. There is speculating and postulating. I wonder who the father is, and well, if it was my kids. Murmurs in the streets about what she did between the sheets, ridicule in school about how the boy left her like a fool, never-ending constant judgment, feeling like eyes are on her every movement. When will it end? With the baby's inducement? Thank you.
Wow, that was absolutely phenomenal. Thank you so much for taking the time to write that very impassioned piece. And I also want to compliment your lights. I don't know why I apologize about it because I like it very much. And now, moving to the other item on the agenda, I welcome Helen Royer, Director, Human Development, CARICOM Secretariat, to deliver some remarks. Welcome.
Good afternoon. Thank you very much. Honorable Michelle Shebart, Minister of Health and Wellness, Belize. Ms. Alison Drayton, UNFPA Regional Director for the Caribbean. Dr. Andres De Francisco, Department Director, Family Promotion and Life Course, Pan American Health Organization, Washington, D.C. Dr. Sanjay Cafe, Adolescent Health Unit, PAHO, Washington, D.C. Other stakeholders and participants, good evening. It gives me great pleasure to offer remarks at today's ceremony in celebration of Adolescent Pregnancy Week 2021. And I apologize on behalf of Dr. Douglas Slater, Assistant Secretary General of the Directorate of Human and Social Development, who due to other competing priorities was unable to attend, but has conveyed best wishes for a successful launch. The Caribbean Congress on Adolescent and Youth Health held in 2019 presented a watershed moment for the region to recognize the centrality of youth in development and to prioritize the health and well-being of adolescents and youth. The inaugural observation of Adolescent Pregnancy Prevention Week and the launch of the roadmap for promoting the health and well-being of adolescents and youth in the Caribbean last year, 2020, are steps in the right direction. This year's theme, No Child Pregnancies, is a goal we must relentlessly pursue when we consider the long-term implications for each teen who has conceived before being physically, mentally, emotionally, or financially ready for the long-term commitments that go hand in hand with bringing another life into this world. It is a commitment we must vigilantly honor as we work together in partnership with our adolescents and youth, their parents and guardians, to ensure no child pregnancies. As service providers, technocrats, and policymakers, we are all well aware of the consequences for the adolescent and cumulative negative socioeconomic impact and propensity for higher levels of poverty on the family, community, nation, and region resulting from child pregnancies. These include, but are not limited to, premature deaths due to high pregnancy, discontinuation of education, and high levels of unemployment in a world of work which is already biased against females. What a heavy price to pay for any young person who may have made an ill-timed, uninformed, unwise decision, or one who had no voice in the shaping of her condition, and I refer to both boys and girls. To date, parts of the Caribbean still have some of the highest rates of teenage pregnancy globally, despite the many frameworks, initiatives, and programs developed to address this problem. One can recall, for example, the Regional Health and Family Life Education Initiative, the Plan of Action for Adolescents, Sexual and Reproductive Health and Rights, the CARICOM Integrated Strategic Framework for the Reduction of Adolescent Pregnancy, among others. We must therefore re-examine and address as a matter of urgency shortfalls, bottlenecks, or ill-designed programs that may lie behind the perennial problem of teen pregnancies in our region. As a region, we need to interrogate systemic and cultural barriers preventing us from moving ahead with the agenda of ensuring adolescents' health and well-being, strengthening the enabling environment, and cultural re-education should be among the list on the menu from which to build our programs. Last year, at the inaugural launch, the CARICOM Secretariat committed to facilitating and supporting the implementation of the roadmap for promoting the health and well-being of adolescents and youth in the Caribbean, many of which are already initiatives being pursued by the CARICOM Secretariat. We have made a deliberate effort to start reconstruction of the CARICOM Youth Development Action Plan with a keen interest in assisting the member states and the associate states in fortifying their policy environment to strengthen the services and opportunities provided to adolescents and youth. In short order, we will be administering a youth development survey to ascertain the challenges and opportunities respectively encountered and available at the member state level. We will use the findings from this survey to support our regional reach to ensure a policy environment that can facilitate strengthening youth development programs, but more specifically, the provision of health and well-being interventions at services at the state level. Cognizant of the devastating impact of COVID-19 pandemic on the mental well-being of people across the Caribbean, but more so adolescents, we are currently designing a mental health first aid program which seeks to build the capacity of youth workers and leaders to be first responders in addressing the psychological difficulties faced by youth across the community. We express our gratitude to the Pan American Health Organization, who has provided material for the development of this program and the continued support provided. In closing, let us remember that to a large extent, the future of any nation rests in the hands of its young people. In the Caribbean, we are blessed with young people who are vibrant, creative, and innovative. They are our wealth. A tree grows and blooms when provided with the care, nourishment, and treatment it requires. So do our young people with guidance, affirmation, and opportunities. The sky is the limit for them and for the region. I take this opportunity to thank the Pan American Health Organization for inviting CARICOM to the launch of this year's Adolescent Pregnancy Prevention Week and encourage every CARICOM member state to actively participate in mounting an effective communication campaign that will raise awareness on child pregnancy and the role we can play in preventing this socio-economic disaster. I thank you.
And I thank you for communicating the support that we have from the CARICOM Secretariat. In fact, this is the perfect opportunity to segue to some words that were uttered by the CARICOM Youth Ambassador of Trinidad and Tobago, Renee Atwell. She weighed in on this and she said that prevention is indeed better than cure, and that at CARICOM level, we should indeed ensure that women remain committed to taking advantage of educational, professional, and entrepreneurial opportunities. Renee and other young people and adolescents from around the region sent a loud and well-articulated message. They said, "Hear me out." So now let's turn our attention to what else they had to say on this video.
Adolescent pregnancy significantly affects young women between the ages of 15 and 20 in the Latin America and Caribbean region. As we work to support marginalized and vulnerable communities with access and resources to education and healthcare, we must acknowledge the systematic barriers that hinder and stagger our progress. Unequal societal, gender, norms and expectations, exclusion, and socioeconomic disparity significantly affect the quality of lives and the access to opportunities that young persons have to resources such as education, access to safe sex health care, as well as information on safe sex practices. We must increase the development and enforcement of policies to provide a holistic approach to reducing adolescent pregnancies within our region. It is important that we promote and introduce the training of community organizations and the empowerment of young persons to provide information in a diverse manner to meet the needs of our marginalized and vulnerable groups.
Our childhood days should be special, filled with good memories of school and learning, happy friendships and quality time with our family and friends. Childhood should not be about pregnancy. At my age, no child should have added responsibilities such as taking care of a child, while we ourselves as children would be extremely stressful. I am asking out adults, parents, teachers, neighbors, etc. to protect our children. No child should become a parent. Thank you.
Children can be sexually abused and consequently become pregnant. However, this should never happen. If children explicitly understand their boundaries, it would be easier to communicate if they have been violated, and therefore our children would be better protected. Thank you.
Child pregnancy is a major problem worldwide, with approximately 17 million girls below the age of 18 years giving birth. Most teens are unaware that pregnancy at such a young age can affect both the mother and child. Teens are at higher risk for pregnancy-related high blood pressure and its complications than average age mothers. Risks for the baby include premature birth and low birth weight. Pregnancy-related high blood pressure can also harm the kidneys or even be fatal for mother or baby. If you're pregnant as a teen, you might feel frightened and worried about telling your family and friends. Not talking to someone and not getting the help and support you need can make you feel more isolated and depressed. This can lead to problems in home and school. Many pregnant teens drop out of school and some never complete their education. That means a lot of mothers who get pregnant as teenagers live in poverty. I'd like to ask for teenage girls to join communities that offer counseling and support programs that help prevent teenage pregnancy. And as a teenager, ask yourself, are you prepared for the future?
Getting
pregnant at an early age can cause the young mother to become emotionally and mentally unprepared for pregnancy, dealing with labor and delivery, and moreover, raising a child. Many unplanned pregnancies can lead to the young mother finding it difficult to complete high school, and in some cases, they may drop out of it totally. It is important for young girls to learn and understand the consequences of becoming pregnant and ways to prevent unwanted pregnancy.
Child pregnancy can be dangerous to both the mother and the child's health, potentially leading to death. The pregnant child can miss out on her education, putting her at a disadvantage. She'd have a hard time taking care of the child, mainly because most families aren't accepting, and she'd have to raise the child on her own. I hope children can enjoy their childhood and understand that everything will come in its own time.
Ending child pregnancy. Child pregnancy is pregnancy in a girl under the age of 20. Every year, 7.3 million teenagers around the world would give birth to their first child. Girls who become pregnant during their teenage years are often forced to drop out of school and many times don't ever have the opportunity to finish their education. They are stigmatized socially and often don't get much needed emotional support from family and friends. Depression and suicidal thoughts during and after pregnancy are higher among teenage mothers. Complications from teenage pregnancy is a leading cause of death among adolescent females. Babies born to teenage mothers also have a higher risk of health complications. For these reasons and many more, we must end child pregnancy. Parents, friends, families, teachers, and anyone who care about children must speak to both boys and girls about the negative effects of child pregnancy. Encourage us to stay in school and to be well educated so as to reach our full potential in life.
Preventing child pregnancy is important. Underage pregnancy can cause an increase in foster care, a significantly high rate of female dropouts within schools, and can lead to child abandonment. Showing support for these young mothers is important due to the lack of knowledge they may have on parenting. Without help and guidance, this may cause stress to the mother herself, her baby, and by extension, her entire household.
This video. As the world battles the COVID-19 pandemic, we are all called together to encourage responsible sexual activities which prevent unwanted teenage pregnancy. As youth, we advocate for sexual and reproductive health and rights, and that includes the use of contraceptives by all, particularly among our young population. Though many teen parents have progressed to be success stories and champions of industry, we are acutely aware of the challenges and burdens placed upon the individual and family structures all around the world. Between 2014 and 2018, Trinidad and Tobago recorded over 3,500 teenage pregnancies. This is untenable as our society progresses. It places additional burden on our healthcare, social services, and educational systems. However, we celebrate all teenage parents, but take this opportunity to advocate for responsible sexual behavior as we attempt to protect our collective future. It's your choice to live and live free from the burdens of teenage pregnancy. Visit any of our partner or member associations and or facilities to access information and services to help you navigate your journey of sexual discovery safely.
And that is the end of the video segment. And we've heard the young people, they have spoken, the adolescents have spoken, and they said very loud and clear, hear me out. I know what we want. I know what we need. Help us to acquire it. And at this juncture is the launch of the regional study. And I invite none other than regional and I invite none other than Dr. Sonia Cafe, Adolescent Health Unit PAHO, to discuss the regional analysis of pregnancies in girls under 15 years old. Welcome, Dr. Cafe.
Thank you so much, Therese. I apologize because I see that my presentation is not starting from the beginning. Okay, I hope you can see my screen well.
Yes, we can.
Yep, thank you. Honorable Michelle Shebat, Minister of Health and Wellness, Belize, Ms. Helen Royer from the CARICOM Secretariat, Alison Drayton, UNFPA Regional Director, Dr. Andres de Francisco, my boss in Washington, DC. And I would like to give a special shout out to colleagues who have worked tirelessly in the past weeks to organize the events of this week. My colleague Sandra Jones from the PAHO Sub-Regional Office team, Donna Da Costa from IPPF, and Shanti Singh, Dr. Shanti Singh from PANCAP CARICOM. And of course, the young people such as Therese and Kimberly and others who have worked tirelessly. My congratulations and thank you very much for your effort. So my task today is to provide a very brief overview of the regional study initiated this year in the context of the Adolescent Pregnancy Prevention Weeks in Latin America and the Caribbean. The week in Latin America is commemorated the last week of September, and in the Caribbean, the third week of October. And so just 5 to 8 minutes, I will try to respond to a few questions. Some of these questions have already been ably answered by previous speakers and also by the young people. First of all, the first question, why the focus this year on pregnancies in girls younger than 15 years old? Why is it important? And you have mentioned several of the reasons, including the magnitude of the problem. When we talk about the public health problem, it's a problem that affects a significant proportion of society directly or indirectly. And the WHO estimates that on global level, we have almost 800,000 girls under 15 years old who give birth in developing regions alone. And so if you calculate that, how many it is per month, per day, it is a significant public health problem. In addition to the magnitude, we also have some of the other reasons that have been mentioned already, that adolescent girls younger than 15 face elevated risks of maternal mortality due to some simply biological factors such as lack of maturity of the reproductive system, but also because of the unequal distribution of unplanned and very early pregnancy. We think about poverty, stigma, poor access to health services in remote areas where some of these girls live. And then, of course, we have in some societies, we also have a racial bias. We see that these social determinants of health really concentrate adolescent and very early pregnancy in some specific groups. In addition to mortality, we have other risks related to very early pregnancy. And I just will mention a few: preeclampsia, eclampsia, systemic infections, and of course, the risks to the babies. The babies of adolescent mothers face higher risks of lower birth weight, preterm birth, and neonatal conditions. These are some of the key reasons why pregnancies in girls younger than 15 are important for us to keep in mind and to address in a very specific manner. It was also mentioned that early pregnancy has mental health implications, anxiety, depression, post-traumatic stress, in particular when these pregnancies are the result of sexual violence or rape. Studies have documented higher rates of suicide and suicide attempts in girls who have been the victim of sexual violence and these undesired and unplanned pregnancies. Pregnancies in young girls, younger than 15, are most often than not the result of sexual violence, rape, or incest. In most countries, also in the Caribbean, engaging with girls young in sex with girls younger than 16 years is against the law. And so in many instances, it is still considered rape. And when sexual engagement with a family member takes place, in many countries, it's also considered an aggravating circumstance for statutory rape of minors or violation. And so we have the legal aspects, we have the biological aspects, we have the socio-economic aspects of very early pregnancy. And then we have the case where very early pregnancy poses a risk for the health and the life, the very life of the girl, but she is denied opportunity to terminate that pregnancy. And so international law says that forced child pregnancy is a crime against humanity. In some cases, it's defined as a war crime. And so these are very serious issues we are talking about when we are talking about the issue of very early pregnancy. However, and I think Dr. De Francisco mentioned that, data on pregnancies in girls younger than 15 years is very limited. And why? Some of the reasons are that there are no standardized global estimates of fertility rates in girls younger than 15 years. To the contrary, in girls 15 to 19, there are standardized rates that are country by country, sub-regional, regional, and they are calculated annually. But up to now, we are beginning to see that globally, we're beginning to develop methodologies to estimate these rates, just also indicating this growing recognition that we need to give more attention to this issue. However, it is not easy to calculate or to estimate the pregnancy rates in girls younger than 15 years because it is difficult to determine what the denominator is and what the numerator is. Just as an example, girls 15 years and older, we assume that the majority of them are already able to reproduce. They have already started their menses and they are able to reproduce. But that's not the case with girls younger than 15. For example, if a 9-year-old becomes pregnant, which unfortunately happens, we cannot use the whole group of 9-year-olds as a denominator to calculate a rate. And so it's a little more complicated to calculate the real and especially a standardized corrected rate of pregnancies of fertility in girls 15, younger than 15 years. However, it is not impossible to document the trends in pregnancies in girls younger than 15 years. Main sources of information that can be used are census data, vital statistics, but also data collected through household surveys, such as the DHS and the MICS. They collect what we call retrospective data by asking older women how old they were when they had their first pregnancy. Thankfully, on global level, with the era of the SDGs, the Sustainable Development Goals, the world has agreed that this is something that we need to address. We need not only to measure it, but we need to address it. And so we're all very pleased that pregnancies in girls 10 to 14 years has been included in the Sustainable Development Goal indicators, specifically indicator 3.7.2. It calls on the world to monitor adolescent pregnancy, and it calls on the world to monitor the whole age group, 10 to 14 and 15 to 19. So that's a call to action for all of us to make bigger efforts, to increase our efforts to monitor, to measure, and to put in place mechanisms to be able to respond to the question, what is the situation of pregnancies in young girls in your country or in your community? Now, because of this lack of data and because of the consensus among the partners who you see on the slide to focus on pregnancies in girls younger than 15 years, the agencies collectively decided to implement a study, a regional interagency study on pregnancies in girls younger than 15 years. And what is the goal of this study is to analyze the current status of pregnancies in girls younger than 15 years and also the current status of the response. And how we propose to do this study? First, through the analysis of available data, vital statistics, population-based surveys, and the analysis of policy strategies and plans. And as a third element, also consultations with stakeholders. And this study was initiated in around April this year. It's not done yet, but I am able to, in a few slides, to give you some preliminary results. First of all, you see on the map, the distribution of pregnancies per 1,000 girls, 10 to 14 years, in Latin America and the Caribbean. We were not able to get data from all the countries, but happily, I can say we have found data for several Caribbean countries, including the Bahamas, Belize, Jamaica, Suriname, etc. And so here you see that there is quite a variation in the weight of these pregnancies in girls younger than 15 across the region. A very modest estimate from the demographers who conducted this study is that in Latin America and the Caribbean, we have an estimated 43,000 births we had in 2019 in this age group 10 to 14. I personally think that it's quite modest estimate, but even if true, it means that on average, we have every day 120 young girls younger than 15 who give birth in our region every single day, 120 girls. Plus, we're not counting all the pregnancies that do not end in a live birth. That end in a miscarriage or an abortion. Another piece of data that was collected was looking at the trends in these pregnancies compared with pregnancies in the age group 15 to 19. And you will see that in some countries it's going up, in others it's going a little bit down. However, in almost all the countries, we see that the rate of reduction of pregnancies in the age group 15 to 19 is faster than in the age group 10 to 14, meaning that we are making faster progress, albeit slow, in the older adolescents compared to the younger adolescents. And we don't even take into account the impact of COVID-19 here. Two more slides. This is another slide, a piece of data that illustrates the risks we are mentioning the risks of very early pregnancy for the offspring of the girl. Here you can see the orange bars show the percentage of low birth weight by age of the mother. In the orange bars show the mother's age of 10 to 14, and the blue bars, in the blue bars, the mothers are 15 years old or older. And it's striking that in all these countries, we see, and unfortunately, there was not enough data to calculate this for a Caribbean country, but here you see data from 9 countries in our region, and in all of them, you see significantly more low birth weight babies when the mother is 10 to 14 years old. We will continue these types of calculations, and if we get more data, we will add that to the study. One more slide about the analysis of the response. The team of consultants, they reviewed all the adolescent health and adolescent pregnancy prevention plans and strategies and policies they could find. And they reviewed them on if they mention specifically pregnancies in girls younger than 15, and if there are interventions specifically for this group. And as a result, we can report to you now that less than 30% of the countries with adolescent pregnancy prevention plans or strategies have specific mention of pregnancies in girls younger than 15 and specific interventions. And even the countries that do, they report major challenges to implement these interventions. And these challenges include legal and policy, health system, and societal challenges. So all of this shows how much work we still have to do to better understand and to better respond to this important issue. So what are the next steps? There will be a regional launch of the 2 reports, one report on the data and the other report on the response in November. We will have a webinar where we'll present in depth in an interagency effort on these 2 studies. And the studies and consultations with stakeholders will result in a regional guidance document that we are hoping will bring together what we know about the situation and what we know about what works and what does not work, so countries can make informed decisions moving forward to address this problem of adolescent pregnancy in girls younger than 15 years. I think I'm done. Thank you very much for your attention. Back to you, Therese.
Okay, thank you so much, Dr. Cafe. I think we have time for one question to Dr. Cafe. Is there anyone with a burning desire to ask something? If not, then we can quickly move on to the other item on the agenda, which is a spoken word by Brandon Singh of Guyana. So I welcome Brandon Singh to the spotlight.
Protocols observed. Thank you, Mrs. Lord, for that introduction. I will be presenting a spoken word poetry entitled Sophia, originally written by me, on the theme Child Pregnancy Prevention. Permit me to begin. Thank you. Selfish, apathetic, immoral. These were her labels as a teenage mother. Her tears were never enough. Even though they filled every corner of that dark square, she slumbered for many summers. 9 months of anguish she never asked for, only for a man she never knew to decide that fate for her. Taking a trip down memory lane to that marvelous night, she was singing, she was dancing, her soul was so bright. But like a shadow, he came and he made her float as high as a kite. She tried to come down. She tried to make a song, to sound, but the winds were too strong. Her voice was burnt out. Only 16, she had big dreams. To live in a big old city, to complete her medical degree, to be free like how any other teenage girl should be. She is Sophia, a fighter, a feminist, a woman living more than her dreams. She lives in me and every other teenager listening to her story. Young girls, protect each other, lift each other, say no to peer pressure, say no to drugs, unintentional or not. Be percipient, be streetwise, join educational clubs, and let's end child pregnancy for once. Thank you.
Absolutely phenomenal job. Thank you for that. And at this point, I welcome Honorable Michael Shabat, Minister of Health and Wellness from Belize, to deliver special remarks. Welcome, Honorable Minister.
Thank you very much, Ms. Therese, Lord, for your kind words. Good afternoon, good evening, wherever you may be across the region. Ms. Alison Drayton, UNFPA Regional Director for the Caribbean, Dr. Andres De Francisco and Dr. Sonja Cafe from the Paho, Washington office, Ms. Helen Royer from the CARICOM Secretariat, distinguished guests, distinguished adolescents, ladies and gentlemen. I would like to thank the organizers for inviting me to the launch of the 2021 Adolescent Pregnancy Prevention Week in the Caribbean. Adolescence is a phase of life between childhood and adulthood. It is a critical period that impacts the rest of our lives and that of every child. Parents have the greatest responsibility of caring for their child or children during this critical life-changing phase, and so too does the state. The Convention on the Rights of the Child describes the most critical results for children or persons below the age of 18 and laid out the state party's obligation with a life cycle approach and based on human rights. It is not easy being an adolescent today. We're living in an era with evidence of broken family structures, significant social media influence, which impacts all aspects of pre-adolescent and adolescent lives, and societal tolerance to negative results affecting adolescents. It is a right of adolescent girls to grow and develop to their full potential. Unintended pregnancies for young girls have negative health, social, economic, and consequences on national health systems. Adolescent pregnancy exposes our children to adult responsibility too early in life. Every child giving birth to a child has been cheated critical years for themselves from their lives. The transition from childhood to adult relationships and the experiences of pregnancy and childbirth causes the adolescent mother to suffer stress or depression as she is psychologically unprepared for the extraordinary responsibilities. Some die in the intent of becoming a mother, an adult responsibility. Can a child less than 16 years consent to sex? By law, sexual activity in the children below 16 years is a criminal offense, and many are due to rape and incest. Many adolescents die in the name of culture. Many die in the name of gender, when men force young girls to sexually pleasure them, or when men rape girls, a crime sometimes socially accepted. All those examples are contrary to basic human rights, contrary to the Convention on the Rights of the Child, contrary to our nation's constitution. Today, I stand before you, not only as a policymaker, but as a proud father of 3 children, and I would do anything to keep them safe and protect them from preventable situations like teen pregnancy, rape, and any other form of abuse. And today, I would like for all the leaders and policymakers in the region to be reminded of the Convention of the Rights of the Child and other agreements, not only internationally, but nationally, that can protect the health and rights of adolescents, particularly girls, as we are here addressing child pregnancies. I do believe that there are many gaps, such as policies at all levels, that can be addressed together as CARICOM member states, formulating appropriate public policies regionally for national application and the introduction of age-appropriate comprehensive sexuality education will help to educate and to serve to protect adolescent girls from sexual violence incest, and partner violence. Governments must identify ways to guarantee adolescent girls access to appropriate sexual and reproductive health, which is a basic human right. We are living in a time when our children have access to all types of information. And as policymakers, we must ensure that they have access to the right information. No child should carry out adult responsibilities. We must increase the investment in preventing all forms of abuse in children, including adolescents. Let us aim for the next 5 years to have the policies and laws in place and a revised judiciary system to increase the rape conviction rates, which we hope will reduce the number of cases of adolescent pregnancies and eliminate the suffering our young girls are exposed to. Belize has taken significant steps to address adolescent pregnancy and access to age-appropriate services. The Belize Adolescent Health National Strategic Plan for the period 2019 to 2030 has been completed. Its launch and implementation, however, is on hold due to the COVID-19 pandemic. Our local stakeholders are revisiting the strategies as we continue to live with the circulating SARS-CoV-2 virus. I would like to take a moment to share with you the provisions for adolescents as stated in our health education, in our Adolescent Health National Strategic Plan. And they are as follows. Every adolescent will have 1, a social security number, 2, routine screening for wellness, 3, access to appropriate health care, including mental health services, 4, access to health literacy, information on sexual and reproductive rights, and health and practices, healthy lifestyles to remain in good health. 5, access to appropriate educational experiences. 6, access to environments that promote different forms of creative expressions, connectedness, and sense of belonging. 7, adolescents at risk or living in poverty, victim of any kind of abuse or neglect, has a single information system for beneficiaries number and receive support. 8, receive adequate information and mentoring about the options available for their future and facilitate transitions to employment, including job search and preparation. 9, parents or other primary caregivers receive information on adolescent health and development. 10, participation in spaces that allow them to express their ideas and decide on matters that affect themselves and their communities. And 11, adolescents interacts in environments that support safety and prevents injuries, violence, and neglect. The above mentioned are the adolescents' unmet basic needs for which we need to close the gap as early as we can by 2030. Obviously, it cannot be done by one institution. It requires a multi-sectoral approach. Adolescent pregnancy is a social product. The adolescent birth rate worldwide is 50 per thousand of girls 15 to 19 years old, 79 per thousand in Latin America and the Caribbean subregion, 60.7, in the Caribbean, and 70.4 in Belize, based on the MICS done in 2015. Interestingly, the adolescent birth rate for Belize fell from 55 per thousand in 2019 in the pre-COVID-19 period to 45.6 in 2020. Together, we can offer our children a better future. Together means parents, adolescents, state parties, and other stakeholders. I thank you.
Excellent. Thank you so much, Honorable Minister, for highlighting the importance of partnership for everybody to come together for the shared goal. At this juncture, I now welcome Delon Matheson, a thespian from the Oratory Foundation of Trinidad and Tobago, to deliver a dramatic poem. I can hardly wait. Welcome, Delon.
Hello, good evening, and all protocols observed. This is a piece entitled Get the Gist. It's a dramatic poem, as Therese would have shared, and it basically talks about understanding how precious and vulnerable our young people are, and puts emphasis on the fact that there are so many people out here who, both parents and strangers alike, who are unaware of the vulnerability or the realness of adolescent pregnancy. So I hope you all enjoy. It's called Get the Gist. Concerning moral instructions, there is much that needs to be taught to our children. Tools to help develop a concept of positive thinking, building a foundation on sobriety to support their understanding. Education is important. Lessons to assist with navigating through life will prove salient. Policy pontificates planting seeds of purpose, but action activates actualization in the youth among us. To state it simply, talking is not enough. Implementation and pragmatism must lie at the cusp. Some of the best examples we see of prevention policy implementation come from our observation of the animal kingdom. On the topic of adolescent pregnancy prevention, the adolescence itself is only one small part of the equation. Policymakers act as parents, providing a foundation for the youth in this instance. Like the old people in all their wisdom would roar, prevention is always better than cure. You see, it is vital for us to know the importance of teaching our young ones as they grow. Animals do it. So why as humans, we never seem to get the gist? An empty crocus bag cannot stand up. Therefore, we must pour values into our children, filling them, edifying from bottom to top. Because before belly start to grow, there is much that goes on that you just don't know. Children without properly constructed value systems are more likely to find themselves in compromising situations. In order to prevent such a revelation, guidance is needed through wisdom and admonition. For example, look at the cheetah. On land, known as a quick and deadly predator, these animals generally go through stages, cubs to adolescent, and adults through those stages. Despite being a predator, the female cheetah will stay with her young for as long as she could. In most cases, they are together straight into adulthood. This parenting formula is to ensure the young does not fall prey to another predator, because this parent understands that her child is vulnerable to the elements and that it is indeed in need of being taught the simple skill of discernment. In the case of the eagle, bird with majesty, high flight, speed, strength, and beauty, so many qualities of richness to uncover. And as a result, they teach their young to keep in keys with that demeanor. Before the eagles start to teach their young about flying, they ensure they know the concept of flapping. Gripped firmly to the nest, wings spread, and wind resistance will promote movement. That understanding is vital information to be taught before the lesson of flight out of the nest is brought. The same concept applies with children. Values are to be instilled from an early age within them. Stand by their side, support and nurture. Help with the building of qualities promoting resilience in character. If animals understand it, that means we as humans could get the gist. Another topic, one which there is a lot of us humans could mimic, is that teaching is not all that there is. In most cases, choice of environment can determine the promise of either torment or bliss. Parents must be aware of where they place their child. One wrong decision can cause grief beyond boundaries, my. Imagine putting your child in the arms of a predator and you there, open and trusting, none the wiser. Vigilance is a huge part of the prevention strategy, understanding the qualities that comes with the territory. Listen to this nursery. Rockabye baby on the treetop. When the wind blows, the cradle will rock. When the bough breaks, the cradle will fall, and down will come baby, cradle and all. Rockabye baby on the treetop. When the wind blows, the cradle will rock. When the bough break, the cradle will fall, and down will come baby, cradle and all. That is what we as humans singing and no doubt promoting. Meanwhile, we have an animal, the eagle, building a nest out of harm's way, away from predators. And we as humans putting our children on the branches of impending disasters. A turtle will lay its eggs in holes for protection. A chicken will sit on its nest for 21 days like a watchman. The animals seem to know it. So why as humans, we cannot seem to get the gist? Environment is important. To that understanding, we cannot afford to be resistant. If you are situated in a location where danger is imminent, protection by herding is recommended and salient. Look at an elephant. Babies are quite vulnerable to predators on the hunt. So adults would create a barrier to secure its protection. No doubt, strategies coming out of experience and wisdom. Creating a warlike stampede, scaring off all predators, intended to protect the promise of their young at all costs. And if animals could understand this, then why is it so difficult for us as humans to get the gist? Instead, we sing in Rockabye Baby with our children up in a tree. If we cannot continue to fight against that mentality, pregnancy prevention will become an alien concept completely. In fact, a hands-off approach might just be promoting the opposite, but programs promoting action are things from which all can profit. Animals already seem to understand it. Now it is our turns as humans to get the gist. Thank you.
Wow, Dylan, I got the gist. Excellent, excellent, excellent. Fantastic. I can't think of a better note to end off today's proceedings. Thank you so much. I extend heartfelt thanks to all of the hardworking organizers and planning committees, speakers, and all in attendance. At this point, I would ask for all speakers to kindly turn on your videos so that we can get a photo opportunity for documentation. And in the interim, for the participants, I encourage you to stay connected because there's so much more to behold as the week progresses. Join us on Wednesday for the intergenerational dialogue, on Thursday for the webinar, and Friday for a virtual town hall. All of the links have been provided in the chat, so please register before it's all filled up. So now we will take our photo as everybody's cameras on. Turn to your best side. Let me find mine. Okay. So everyone, thank you so much. I encourage you to stay connected. Remember to register in advance. Do not take it for granted. Do not procrastinate. We love you. We appreciate you. Tonight was fantastic. Have a wonderful, wonderful evening. Thank you.
Thank you very much.